Sarah Michaels, Sine, actually reached out to me because she said that she had a gentleman that went down here, which I found out as you. And so she wanted to make sure that they had one here, and especially with them opening up the gun range, I think it's a good place to have one, just in case there is a problem, in case anybody goes down or has any kind of medical issues. I met John and Yashira a few years ago, and they've been backing me 100%, and I thought there's no better place to have one here, because I feel like businesses are supposed to support businesses, and they always support my foundation, so I want to support them. I always come out to all the locations and I tell my story, and then as to why I started the foundation, and then I hand it over to Eric, who is with the Winter Haven Fire Department. He has EMT with them for how many years?
23.
23 years. He was actually on site the day that I lost my fiance at the time. So I want to tell you the story of how I got started. In July of 2020, I had just returned back to my hair salon in Winter Haven. I had my 4- and 5-year-old grandsons with me. Michael Culpepper was not feeling that well that day. He was my fiance. I went home that afternoon and I found him face down, unresponsive. I went into panic. I went into shock. I did not know CPR. I was trying to save him and calm my grandchildren down at the same time. I called 911, and on the 911 call, they asked me if I had a defibrillator. I did not have one at the time. The EMTs came in, paramedics, when Eric was on site that day, and I did not know it was him at the time because they were all covered up. As me and Eric has worked many events together, but I did not know it was him. It was so much trauma going on that day, I did not even recognize him or his voice or anything. I followed them to the Winter Haven Hospital, and as I got to the front door, they told me he was gone. There was no last minute goodbye, there was no last minute anything, they just said he's gone. So I went into grief, despair. I didn't know what I was gonna do. I decided then, in order for me to keep moving forward, I had to decide I was gonna honor his name, and I had to start a foundation to save other people because I couldn't save him. So I then reached out and I got the 911 call sent to me, and I would listen to it over and over, and what stood out to me was the lady telling me on there that, do you have a defibrillator? The dispatch kept asking, she asked me that at least twice. So it stood out to me. So that's why I started this foundation. We raised money to put them everywhere. I ended up going through what would have been our wedding day, and I still took his last name at that point. I went through what would have been the wedding ceremony, and then I started raising the money. It took me about 6 months to raise the money for the first one going out, and that was at Omi and Frank's where he used to work at, and then today is number 57. So, and then now on my team is Eric and Daily Ridge, who support me 100%, and my husband now, Brian, who actually knew Culpepper, and we are married now, and he supports me 100%. I want to turn this over to Eric, and he's going to show you the demonstration and just how to use it.
First we'll go over the Good Samaritan's Law. So as long as you do everything that's pertinent to the patient, people will try to sue you, but nothing's ever been successful across the United States. What I mean by that is you apply the AED to them, you're doing proper CPR, you shock them, you're okay. Now if you try to do, if you try, we watched Life of Trauma in the ER, and you see somebody cut their throat open and stick a tooth down their throat to breathe for them. If you try doing that, then you can be sued. So if you're not doing anything like that, you're okay to do it. And all the stuff that Melanie's got, you can get online. Got the Stop the Bleed, I saw. You can also order that online. We've got so many different things. But with this AED, it's all inclusive in one, so all you gotta do is open up the lid, and it's gonna talk you through on how to do exactly everything. It'll do a little self-diagnostic test, so you'll see some lights come on.
Stay calm. Follow these voice instructions. Make sure 911 is called now. Begin by exposing patient's bare chest and torso. Remove or cut clothing if needed. When patient's chest and torso are exposed, remove square foil package from lid. A make sure pad connector is plugged.
And once you got the chest exposed, you pull out the pads. There's a picture on the outside of the pads, as well on the pads themselves of where to place them. I always tell people, just remember upper right, lower left of the patient. If you accidentally swap them, you got the upper or lower left on the upper right and the upper right on the lower left, it's okay. Don't try taking them off and replace them. It may not stick. So just be aware of that. As long as it's upright lower left of the patient, you're okay. It's going to tell you to not touch the patient. It's going to analyze. That's when you don't want to touch the patient. It pick up your heartbeat or act like it's a heartbeat if the patient moves, as well as the AED. So you don't want to touch either one of those. It'll tell shock advised or shock not advised. If shock is advised, it'll charge itself and then give a shock after telling you to stand clear. Once you do the shock, it'll go right back to your CPR. This one doesn't count down for you, but it lets you know when the 2-minute time is up to reanalyze the heart. If shock is not advised, then we just do CPR. Of course, CPR is forceful, it hurts, so they do some kind of involuntary movement if they're not having a true cardiac arrest event. So they'll kind of, I'll tell you a story with that. If the person's wet, they've been outside running, sweating, they're wet from the rain, it's okay. As long as the pads stick, you're going to be okay. It does come with a little towelette and stuff in there. You can dry the chest off. It doesn't have to be completely dry, just dry enough for the pads to stick. If they have an internal defibrillator or pacemaker, or a combination of both, that's usually on the left side. Sometimes they'll put it on the right, but mostly it's on the left. Looks like a small deck of cards, raise it up about 1/4 inch. If they have that, we're still going to apply the pads. If the AED says shock, we're going to go ahead and shock the patient. If they have any kind of nicotine patch, medication patches on, we don't want to place that pad right over top of those patches. Want to take the patch off, wipe off the medication, and then apply the pads. Of course, it does come with a towelette and gloves. Make sure anytime you're dealing with any kind of patches, you want to wear gloves. Especially if it's a fentanyl patch, you want to get that on you. It absorbs pretty quick and you might pass out from that. If they have any kind of jewelry on, it's okay. Just leave the jewelry alone. As long as it's not underneath the pad, you're okay. So if they have any piercings, necklaces, or anything like that, as long as the pad's not over top of that, you're okay. Yeah, of course. It is an electronic device, so obviously we don't want to take it in the water. If they are in water, like a pool or something, you want to take them out of the water and then apply the pads with that. Once you apply the pads, again, it's going to start to analyze. With this AED, they've been sending a new set of pads with them as well. Oops. So it's a pediatric pads. They're about the same size, but it's got a little chip inside where you plug it into the AED, and it's going to give a less amount of shock for the pediatric patients. So, but if you don't have this, you can still use these pads. It's okay. The only time we don't use the AED is if the person or the patient's 1 year old or less. So they have to be over a year old. If they're under a year old, we're just going to do CPR on them, which of course is quite scary in itself. If you got females and they have that underwire bra, we're not going to try to roll them over to take off the bra. Just grab the bra in the middle of the chest, pull it up to their chin, apply the pads, and you can put the shirt back down over top of them for exposures. Don't pull the underwire bra back down because it could deflect or burn the patient. You definitely don't want to do anything like that. So when you apply the pads, of course, one up here, one down on the side, and then we start our CPR. So while it's analyzing, we're not going to touch the person, but while it's charging, you can do a couple chest compressions while it charges. It takes like 5 to 7 seconds to charge, and then stand clear, it shocks, and you go right back to your chest compressions. We used to do all kinds of things to try to find the center of the chest. We used to find the very last rib, follow up to the xiphoid process, put 2 fingers, and apply your fingers or your hand just above the 2-finger mark. Now we just do center of the chest, lower portion of the breastbone. So you place your hand in the center of the chest. If it feels like you're falling off on that xiphoid process, the little triangle there, just come up a little closer to the chin. If you're way up here to the chin, this is nice and solid up here, you're not going to be able to compress the chest. So you want to make sure you're in the center of the chest. Now when we do in chest compressions, it is forceful. Things do take place. You're not really breaking ribs. What happens is the center of the chest, your breastbone, is connected with cartilage. It allows us to breathe in and out. It's actually called keratin, same stuff that's in your ears and your nose. When that separates, it's called separating sternum. If the person survives a cardiac arrest, it'll be a little sore, but it'll heal. If you line your hand up and it's on the side by the ear or on the other side, then you can break a rib and that can puncture a lung or your heart. Obviously, you know, your heart's over to the left side a little bit, but we're not going to press it on the side. We're going to do it directly in the center. Something else they've changed, it went from 2 inches to 2.5 inches. It just allows you to press that heart all the way to make sure you get all the blood out of the heart and being able to circulate it. And then we went from 100 chest compressions to 120 chest compressions per minute. So it's a lot of chest compressions, right? I always use the song of Staying Alive. So now I just say it's Staying Alive on steroids. So you just go a little bit faster. If you don't remember, just remember hard and fast, upper right, lower left. That's all you have to do. Every 2 minutes, it's going to reanalyze the heart, and then shock advise. If not, then it's going to do, you go right back to your CPR. I was telling you about the movement in the wall, chest wall, and it's separating. So I had a patient, I guess it's probably about 17 years now, I guess. I just become a paramedic. But it was a little old lady, she's laying in bed, daughter was doing CPR on her. The phone was by her head, and dispatch was counting 1 and 2 and 3 and 4. So I just tell her stop doing CPR, reached and tried to feel her pulse. I didn't feel a pulse. So it's okay, I'll take over CPR. Everybody's bringing the equipment in. I do 1 chest compression. She sits up and says, "Ay, papi!" Scared the living crap out of me. Kid you not. And the funny part of the story is, both her legs had been amputated. She was a diabetic. She was in her 80s, but both her legs had been amputated just above the knee. So I don't know how in the world she sat up, but she did. We put her on the monitor, and the reason why I didn't feel a pulse is she had a heart rate of 30. So I just checked for the pulse for a quick second. Since she didn't have a heartbeat of 80 to 100, it was 30. That's why I didn't feel the heartbeat. Unfortunately, I think she died in the hospital, but again, she was a little bit older. But that's the whole premise of it. If it hurts, they're gonna move. If the person starts saying, "Get off my chest," moves for whatever reason, we're gonna stop our CPR. We're gonna leave the pads on, leave the AED turned on, and just roll that person into a recovery position, left or right side. And that's just for the vomit. We don't want the vomit to stay in their mouth. They're not down like this, and for whatever reason you're not paying any attention, then they can aspirate that and clog the airway, and they're not going to be able to breathe. So we want to make sure we put them into the recovery position. With the pediatric patients, so if, teenagers, it's the exact same thing as the adults. The only thing is you might not have to use 2 hands, you might only need 1. And then with the infant, it's the only time you're going to change your hand placements. We prefer you to do it in the center like this, so the patient is down on the floor, and you're doing your chest compressions as such. And then if we do elect to give breast, we're going to cover the mouth and nose with our mouth if you don't have a one-way valve mask. I always recommend not doing mouth-to-mouth on somebody if you don't have a mask, and you can do up to 10 minutes of CPR without providing any kind of oxygen with them. But inside this is a true one-way valve inside, so if the person vomits, it's just going to go up to the mask and it won't come up into your mouth. If that happens, you want to clean the mask out, obviously, clean the face off. And then when EMS gets here, we got all different kinds of masks. Obviously this one doesn't fit on that, so we're not going to use the large one. We'll do mouth to mouth with this patient. Make sure you cover your face and nose with your mouth. When you're doing giving your breast, I always said tilt your head back. With the pediatric patient, you got to be careful, because if you go too far, it can occlude the throat, and if you don't go far enough, it can occlude it. So what I always tell people is just consider the sniffing position, where they lift their nose up to smell. So just raising the shoulders off just a little bit, and that's it. So if you have a small towel, you can roll it up, put it underneath your shoulder blades, and then do your mouth to mouth. Again, you don't have to do mouth to mouth for up to 10 minutes with the person. So with that being up to 10 minutes, so we're breathing 21% oxygen right now. We give it mouth to mouth 15 to 16% oxygen. When you're doing chest compressions, just start bringing in about 5 to 7% of oxygen as you're doing a chest compression, because it's creating some kind of a vacuum. So they're okay up to that 10-minute mark. A lot of times you'll see people get on, or EMS gets on scene, or fire department. We're doing a lot of things at first, and we may not even put oxygen on a person for up to 10 minutes, depending on what's going on. As more units get there, you have somebody that's not doing anything, then they can put in an advanced airway. But we gotta get the AED on them, we gotta start IVs, and start giving them medications to help out that heart get back beating again. So again, up to 10 minutes. Now, Mel's got a lot of stuff up here. Sometimes it's kind of overwhelming. She has bought these masks here. So this is for choking. So we know the Highland maneuver, but this takes it all out. You just place the person on the floor if they're not responding to you, and then you use this. So once the mask is in, it does fit kind of tight, but sometimes it will come off. So when you got it to the person's face, you want to hold on to the green part of the mask. That's what we're going to press down on. You press this, it's a one-way valve, it lets all the air out, and you pull up and it brings the object out of the mouth. Usually it happens the first time, it may take 2 times to do it, but it's really simple. Anybody can do it.
I'm all about saving lives, so I saw somebody choking in a restaurant, and it triggered me to get this. So
it's a lot easier than doing a Highland maneuver.
Yes.
On somebody, yes.
It's more effective.
Definitely more effective. With the Narcan, this is the same Narcan that a police officer are carrying. It's intranasally, so if someone's not responding to you appropriately, they're on maybe some kind of opioid overdose. They're going to have a decreased respiration rate. They're going to be unresponsive. you may not even think they have a heartbeat because they're just out of it. So we're gonna open up the package, place it in the nostril, and then just push the plunger into the nose. It does come with 2, so after about 3 minutes, if the person doesn't come around, you can do the nostril on the other side. Make sure we push it kind of hard and fast so it aerates it. If you just push it slowly, it's just gonna leak out. It's not gonna aerate, and then your mucous membranes in your nose won't be able to absorb it properly. Obviously, this is just try to be a quick fix. They need the IV Narcan to really bring them out of it. Be careful though, when you do give the Narcan, especially if you're on your second dose, Melly finds somebody on the side of the road, she's by herself, like, oh, I'm gonna give some Narcan. Does one, doesn't come around, does the second one, they come up, they're on, you just took their high away from spent the last $20, and now they want to fight. First person they're gonna see is her, kind of small, she's gonna be in trouble. So make sure that other people are around before you start giving your Narcan or whatnot. Police officers only give 2. We prefer them only give those 2. So if another police officer shows up, we don't recommend another police officer giving 2 more, and another police officer shows up gives 2 more. We just prefer them just to do 1 dose. It is 4 milligrams in this one and then 4 milligrams in this one. So it's a total of 8 milligrams of Narcan, which is quite a bit of Narcan. If it doesn't work, there has never been anybody that's been allergic to Narcan. This has been in service 20 years at least. No one's ever been allergic to it. So if it's not an opioid overdose, you thought it was, if it's some kind of benzo like Versed or Ativan or something like that, they can still have the same symptoms as an opioid. But when you give the Narcan, it's not going to reverse the effects. And it doesn't really reverse the effects. What happens is it binds with particles in your body, and then it doesn't allow the Narcan or the drug to take place. So it's blocking the receptors. It doesn't really reverse it. When you do give the Narcan, also be aware of the person could become, he'll start vomiting. I have seen people push it really hard, and the person just starts projectile vomiting. Had one in the back of an ambulance, started an IV and a medic on the truck, pushed it. Well, he pushed it pretty fast, and then gave flush to flush the line out right after. It probably 10 seconds. That guy sat up, and the vomit was hitting the back doors. I mean, it's just that violent. So we want to make sure we don't. Nasally, you're okay, but you see people on scene, paramedics, they want to push that real fast with that.
Now I have a question on this one actually.
Yes.
I just thought about this. If they are having an overdose and it's affecting their heart, can you still bring them back?
Yep. So because it's blocking those receptors of that opioid.
Okay.
So we want to do that if it's an opioid overdose. Now you can't tell unless you do blood work, obviously.
Okay.
But if they're unresponsive, they have a decreased respiration, you don't think they have a pulse, we're gonna give the Narcan. If the Narcan doesn't work, we're gonna go ahead and start doing our CPR because they have something else laced in there besides just the fentanyl. We had one, I don't know, I guess it's been close to a month now at 7-Eleven in Winter Haven off of Cyber Garden Boulevard. I have the station out there, but she was in the women's bathroom and she went and got her fix, came there and then did the drugs in the women's bathroom. So she was unresponsive on the floor, really bad. SO got there first, secured the scene, and she still had the needle in her hand.
Oh, wow.
And she was on the floor unresponsive. They gave their 2 doses of Narcan, didn't work. We pulled her out, started an IV, and I gave the Narcan IV, and she came around. So again, this is effective, but not as effective as the IV lines.
And I started carrying this because I'm on all the events. I do a lot of the bars with the bands and all that, and I've seen them fall out with the fentanyl, and the EMTs come in and use that and bring them back.
Now these do expire. So these expire, the pads expire, extinguishers, they expire, you get them retested. Everything else doesn't really expire. So when you have these that's been on the wall for years and years and years, you just pull it out, make sure it's not cracked or anything for proper seal. With the pads, when the pads go out of date, I always tell people to keep the last set of pads that they have. Obviously you don't want to keep all the pads, but say you order another set of pads, these pads went out of date January 1st, you order a new set of pads, keep this set of pads with the AED. It does come with a razor blade, but it's only a 1-bladed razor, so if they're really hairy, it's not going to take the hair off. So I tell them, get the expired set of pads, place that on the chest, press it down real good, rip it off, take the hair off with it, and you apply the new set of pads to them. It works great. It's done it lots. It really does work. With the AED, as you can see now, it has a red light in there. So anytime you're up, it's on the wall and you see that red light, you want to open it up and it's going to tell you what's wrong with the AED once it goes through its self-diagnostic test. Now it doesn't tell you pads are out of date. It's just gonna say check pads or connector. So you check the pads and connector, it's nice in there, and then you can check the date to make sure it's in date. So when you open it up, again, it's gonna do a self-diagnostic test.
Stay calm. Follow these voice instructions. Make sure 911 is called now. Make sure pad connector is plugged into AED.
And it'll continue to do that until I plug this in. It won't let you go to the next step.
Make sure pad connector is plugged. Begin by exposing patient's bare chest and torso.
And then go through the whole thing
cut
again.
clothing.
And then when you close the lid, this will go back green. If it doesn't go back green for some reason, the battery could be going out, or again, you might have the pads might be out of date. The battery does go out of date as well. They're usually good 5 to 7 years. They say up to 1,000 shots. I say 750, or they want to, say, oh, we can do 1,000 shots. We have to change up the battery. Most of the time, the battery go out of date before you give that many shocks. That's an awful lot of shocks. But you order a new battery. They do charge a core charge, almost like a alternator in your car. So once you send that back, you get your money back. When you get it, it only goes in one way. So place it in there, and then you got to do a self-diagnostic test for it. It won't turn back green until you open up the lid. It does a self-diagnostic test.
Stay calm. Follow these voices.
Light turns green, and you're good to go. Pretty simple. With the pads, if you go online and order the pads, they come in different amounts. I highly recommend not getting a set of 10 because they're all going to be the same date, and then you're going to have 10 pads out of date. But if you want to order a set of 2, save a little money, that's good. I wouldn't order any more than 2 at a time.
And I know you guys are gonna put it right here, but when you go to get the gun range open, you can just always have it that close to get there before the 911 and before EMT. And tell them what you told me when I first wanted to start the foundation, and I reached out to Eric and I asked him if he'd be on board with me. He said, I said, I'm gonna try to put one on every city block. It's gonna take me a long time, but that's what I'm aiming to do.
And a lot of people say, well, why you want one on every city block? Fire department could be closed, PD may be closed, but prime example is downtown Winter Haven. Everybody knows where Old Man Frank's and Caribbean Bay is. They had somebody go fall out at Caribbean Bay. Caribbean Bay didn't have an AED yet, so they ran across the street, they got the one from Old Man Frank's, brought it over and used the AED on that person. They survived. So that's another reason why we like to put one on every single corner. It's like, well, gosh, you got one right there. Why do we need one over here for?
And he
Prime
also
example.
said the fire station was on the next city block.
Yep.
Wow.
And we made it before
They
fire
got there.
department
Yep.
got there.
If it's an overdose and you put the AED on them, it's going to recognize a heartbeat, so it's not going to shock the person. It's going to be low. With the AED shocking somebody, it recognizes 4 different rhythms for your cardiac, ventricular fibrillation, or VTAC without a pulse. That's what's going to shock. So if it's an asystole, that flat line, you hear people say, oh, it's flat line. There's no electroactivity inside the heart for the AED to shock. And that's when we just do our CPR.
And the reason why I started, I do want to always talk about this at all my places I donate an AED, is I had my daughter-in-law's best friend lost her daughter in a fire on November 7th. The car exploded. The little girl was in there. She did not survive. And I'm promoting fire extinguishers for people to get them for their cars, because people does not know that we can have these and actually put out the fire to help save somebody. So I do promote everybody to try to get a fire extinguisher for the car. I do carry every one of these things in my vehicle, because at any time I can try to help save somebody. That's what I have this all for.
I have 6-pack, $50 on Amazon.
Yes.
Yeah.
Yes. So I keep all this, and I just want to promote it all, because even right down to the choking device, at a restaurant, you can run to the car, get that, and save somebody's life before the paramedics can get there, because sometimes they're they're busy, they're trying to go on another call, and we can actually save them. So.
And with anything up here, again, it's Good Samaritan's Law, and just be wary of that. Don't try to go into a burning building and get somebody out with the small little extinguishers. It's not going to work. So if you did something like that and you were to get burned, you can't sue them for that mishap. So you want to make sure it's not a huge fire. Car fire is okay. You just got to be wary of that, especially if you break a window and it introduces oxygen into the car, that could flame out. So we want to make sure that we're safe. great having these, but again, just be safe with it. Don't try to open up the lid of the hood of the car if it's on fire to get this in there. Just kind of go through a hole if you can. You know, you lift that up. Again, you introduce more oxygen into the fire, and now all of a sudden you're burnt before you even realize it. Another big thing with fires in vehicles is the magnesium, and it's in the dash. That's a heat resistant. It's in all dashes that are, you know, in their firewalls and stuff, and it doesn't combine well with water. So if you ever see a vehicle fire and we get on scene and we're shooting water in there and it hits that magnesium, it just starts flying sparks everywhere. We got to be careful of that because it will destroy your gear. And if you get it on you, it is extremely corrosive, and it's very hot. It'll burn your skin. It can do a lot of damage. So I want to make sure you be careful of that too.
Okay, I think that's it, and I